Hey guys, I got a thumbs up on doing 2 videos a day, so that's what I'll do. Anyway, you might want to get your tissues ready because this is going to be a sad case. And normally I don't like doing the love stories, or am okay with the love stories in the beginning, but this makes it more emotional in this case. Anyway, on to the video.
Jenny and Ray Moyer were ecstatic when their daughter Daphne was born in October of 2003.
It was a very emotional experience. I remember crying, which surprised me.
Ray had a baby about 15 years before Daphne was born, who was born premature, and she passed away from complications from the prematurity.
Having Daphne was absolutely another shot at fatherhood. She certainly felt special.
Everything seems perfect when they leave the hospital, but once Ray and Jenny bring Daphne home, she's inconsolable.
Carrying her and patting her wouldn't help. She might settle down for a little while, but just go into her screaming again. One day, Daphne cried for about 12 hours.
I wasn't overly concerned. Compared to the history I had with my previous daughter, this seemed like a small bump in the road.
But I did always know that there was something more than just what other babies go through.
Right.
Then, when Daphne is 3 months old, Jenny and her mother look on in shock as the infant goes through a fleeting but bizarre episode.
We were both in the kitchen, and I had Daphne on my lap and was feeding her.
All of a sudden, her eyes started going back and forth.
And it was just a couple of seconds, and it was, whoa, what was that?
Jenny got the video camera and videotaped it.
I wanted to make sure that the doctors could see this happening. She would have like a spurt where her eyes would go back and forth for a couple of seconds, and maybe a fraction of a second later they would start again.
We were totally freaked out. We took her to the emergency room right away. Nobody at the ER wanted to watch the video because whenever they would check in on Daphne, she was just laying there and was perfectly normal. If she did have one of the eye movements, by the time we would call somebody to look, it would be over with.
When a neurologist finally examines Daphne, he doesn't think there's anything to be concerned about.
We had to really persuade him to look at that video, and when he did, he still was not moved by it. His explanation was that it was some pre-migraine activity. He told us we could go home.
I was a little disgusted and said, so what are we supposed to do? Just ignore, the baby's eyes rolling out of her head? But we were just given a pat and sent home.
But over the next few days, these strange episodes happen more frequently and begin to affect Daphne's entire body.
Her eyes would go back and forth, and at the same time, she would stiffen out.
And then she'd scream and cry, and the next one would come. She almost seemed like she was possessed.
It was frightening. And it was at that time that I knew that something was seriously wrong with Daphne.
Jenny and Ray start to question the pre-migraine activity diagnosis. Determined to find out what's happening to her daughter, Jenny begins researching Daphne's symptoms on her own.
I just would get on my computer and spend hours and hours typing in eye movement back and forth and arm extensions, seeing what I could come up with.
What Jenny discovers is frightening.
The answer came in a film clip that another parent sent of their child. In the clip, the young boy was doing exactly what Daphne was doing. I mean, exactly.
Jenny and Ray are convinced that Daphne has been suffering from infantile spasms, a form of epilepsy often associated with mental retardation and developmental delay.
At first, the two words together sound pretty innocent, but then I read that it was considered a cataclysmic seizure disorder that didn't respond well to medicines.
Terrified, Jenny and Ray rush Daphne to the ER.
This neurologist came in and saw Daphne having an episode, and he was as convinced as we were that it was
The
infantile
hair's kinda
spasms.
sit on end.
Ray just broke down and started crying. He told the neurologist that he had a daughter from a previous marriage who passed away.
It seemed like a continuation
That's
of a
awful.
nightmare.
Over the next few weeks, the neurologist prescribes a series of anti-seizure medications. Some have devastating side effects, others simply don't work, and Daphne's seizures are getting worse.
The episodes were occurring 20 to as many as 30 times a day, up to 10 minutes at a time.
With each new episode, Jenny and Ray feel like they're slowly losing their daughter.
She seemed to be going away. She seemed to almost be moving towards a catatonic state.
When she was 8 months old, while other babies are starting to learn to crawl and eating pureed foods in a high chair, Daphne was still like a 2-month-old. She just kind of looked to the left and gazed off into nowhere.
She stopped being able to drink a bottle. She had to be given a feeding tube.
I just didn't understand what was going on and how could this be happening to my little girl.
Finally, after agonizing months of trying different medications and watching their little baby succumb to seizure after seizure, Jenny and Ray find a drug that works.
Daphne was seizure-free after her first dose of the new medication. It was a miracle.
She went from sleeping all day to never wanting to take a nap. She would take her rattle and look at the little beads inside as she twisted it around. She really started connecting again.
Can you say hi?
Hi, Daphne.
Is she not the cutest thing?
But the relief doesn't last.
That's what I thought.
Daphne had 5 months of great development and seemed to be making progress. And then when she was 15 months old, she had her first stroke.
It's MoyaMoya disease.
Stroke.
When the doctor explained to us what happened, life just
I
stopped.
know it's a horrible condition, but man,
The
almost
neurologist
makes me
drew
laugh. I can't
a
help
picture of what they saw in
Japanese
Daphne's
folks
MRI. He
Yeah,
showed
the
the
blood
arteries
vessels
running
look
up
like
to
pups.
Daphne's brain. He colored out a little portion to show that it was blocked off. He began to explain to us that Daphne had an unusual finding on her MRI that was called MoyaMoya disease.
In MoyaMoya disease, the main vessels that supply the brain with blood become blocked off. Daphne's brain had been starving for blood, which was causing her seizures and stroke. The word MoyaMoya is Japanese for puff of smoke, which refers to the appearance of tiny abnormal blood vessels that can be seen on the patient's brain scans. Doctors don't know what causes this extremely rare disease, but left untreated, it leads to neurological damage and can be fatal.
It was just devastating, just absolutely devastating.
The only treatment for MoyaMoya is surgery. But doctors tell Jenny and Ray that Daphne is most likely too weak to survive the risky procedure.
Yeah.
They made a plaster cast of her hands and her feet, cut some hair for us so that we could remember Daphne later. We just talked about the things that we were going to miss.
Daphne loved to dance in the kitchen and loved to look at trees, and it was just hard to think about not doing those things with her.
We took her home and we had everything set up for the final event. We had all the medicines lined up. We had all the machines brought to the house to make life as comfortable as possible until it was time for Daphne to go. I just don't think that there could be anything more devastating than losing a child.
I can imagine it.
But she didn't die. She did not die.
It remains to be seen how much damage Daphne's brain has suffered, but Dr. Steinberg is optimistic.
We've seen quite remarkable improvement in the last 6 months. The bypass arteries have now grown in a very luxurious blood supply
That's good
to
news.
both sides of her brain. The young brain can recover in ways that an adult brain cannot recover.
Right.
It won't matter if she doesn't develop to the full potential of a normal person as long as she's happy.
Right.
That's all we
She's
ever
loved.
care
That's
about.
all that matters.
MoyaMoya occurs in only 1 in a million people. Ray and Jenny feel lucky that Daphne was diagnosed at all.
Most pediatricians are not used to recognizing the MoyaMoya disease in a 16-month-old. It is rare. It's not seen even by a lot of neurologists or neurosurgeons.
Daphne has taught me not to take what doctors say at face value.
I'll leave the video here.